Our Justice Exchange is made up of people who have been through the justice system, often been in prison and been through Nacro services and really want to make a difference for people in the future. They told us that mental health in prison was absolutely critical. They'd experienced themselves the challenges of not being able to get the mental health care that they needed, and they saw the impact that had both on themselves and others and really felt that they needed to prioritise this. Well, people in prison have much higher levels of mental health needs than the general population. In many cases, those mental health needs drive their offending, so that's why it's incredibly important that the time in prison we actually really help address them and give people the support they need to help reduce their risk of reoffending, but enable them to have a positive life after prison. Particularly the impact of COVID made things really difficult in prisons. Many prisons went into lockdowns where people were in their cell, locked in cells up to 23 hours a day, weren't able to access the things that really help good mental health. But we've also seen huge levels of overcrowding in prisons, which has a particular impact. There's staffing shortages. There's so many parts of prison life at the minute that really impact on people's mental health. Prisons are really difficult environments to have good mental health at the minute. All the things that we widely recognise as being good for well-being and mental health are very difficult in prisons. When people aren't able to get the education or the work that they want to get, when people are locked up, that can be really difficult to have that social connectedness. Well, we heard from the members of our Justice Exchange that actually not getting the support you need is really difficult in prison. We've seen from the latest figures rising levels of self-harm in prisons, rising levels of self-inflicted deaths. It has a huge impact when people aren't able to get the support they need. We heard from lots of people that were contributing to this report about the long waiting times that they experienced. For example, people in on short sentences had been referred for help but didn't get that help before they were released. Well, that just contributes to that cycle of crime, of going in and out of prison without getting the support that people need, which impacts all of us. Well, in this report and in consultation with the people who've been through our services, we put forward a number of recommendations that actually people should be screened regularly over the course of their time in prison to ensure that any mental health problems are more easily picked up and therefore supported. We also talk about the need for ongoing training of staff in prisons and prison officers who do receive training when they first train to be a prison officer, but a prison officer's role in the relationship with people in prison is crucial, and actually their knowledge and awareness of mental health problems, how to support, how to refer is really, really important. But there are wider recommendations as well about how you make sure that the prison regime itself can help promote good mental health. And that's making sure that actually we tackle the understaffing, we tackle overcrowding, but that people can access what we call purposeful activity. They can be in work, they can be in education, they can have physical activity. All those important steps that we know are really important to good mental health.